This year at ASCO, there were some interesting results that have been presented, in particular in the oral abstract sessions, regarding nasopharyngeal cancer. Last year was the year of nasopharyngeal cancer with many novelties, and also this year we learned that it is possible to de-escalate treatment in some group of patients. In particular, there was a good work presented by Chinese investigators showing that in stage 2 or stage 3 and 0 with a low EBV burden in the plasma, we can reduce the intensity of the treatment, avoiding concurrent chemotherapy. And this is good for the patient and for their quality of life. Another way of de-escalating treatment that has been shown is a dynamic way, because patients treated with induction chemotherapy, TPF chemotherapy, that had a partial complete response and a drop in the EBV DNA load in the blood could receive a lower dose of radiation. And this also has an interesting consequence on quality of life of our patients. This for nasopharyngeal cancer. Then we learned something about radiosensitization. There was a trial showing that docetaxel can be added to radiation in patients unsuitable for cisplatin. It's not a trial with many patients because it was prematurely closed because of the COVID pandemic, but it's something that should be explored for the future. And then also we had an interesting trial evaluating something that we missed in the past. That is an unanswered question, if also in the setting of locally advanced head and neck cancer treated with concurrent chemoradiation with a definitive treatment, and not in postoperative, but with a definitive treatment, if a weekly cisplatin can be the same than of a 3-weekly cisplatin. And this was shown as a possible another way in which we can use cisplatin as a radiosensitizer. So this is another intriguing data. And then I would say the other trial for which I have been very interested, it was the trial presented by Nabil Sabar regarding the combination of Pembrolizumab and Cabozantinib in recurrent metastatic head and neck squamous cell carcinoma. And we know that this multi-kinase targeted drug can be added to immunotherapy, can increase the immunogenicity. And this was true because in this small trial, but the overall response rate was very interesting. 54% of the patients obtained a response. So great signal, a small trial, but useful for the future.